It was an enlightening and instructive gathering of great minds as intellectuals in the pharmaceutical industry, medical professionals, academics, government functionaries, legal practitioners, as well as other stakeholders in the health sector converged for an international conference on the theme Improving Access to Quality Medicines through Appropriate Legislations and Policies. The conference, which was held on 29th and 30th August 2017 at the Conference Center, University of Ibadan, was organized by the Center for Drug Discovery, Development and Production, CDDDP, Faculty of Pharmacy, University of Ibadan, to have stakeholders in various relevant fields discuss about the problems as well as the laws regulating access to quality medicines. The conference witnessed a large turnout of dignitaries and participants, among whom are the Minister of Health, Professor Isaac Adewale, represented by the Director of Food and Drugs in the Federal Ministry of Health, Mrs. Chukwuma Gloria Modupe, the Vice Chancellor of University of Ibadan, Professor Abel Idowu Olayinka, ably represented by the Deputy Vice Chancellor Research, Professor Olanike Adeyemo, the Dean, Faculty of Pharmacy, University of Ibadan, Professor Oluwatoyin Odeku. Other personalities present at the program are the Chief of Party, U.S. Pharmacopoeia, USP, Dr. Chimezie Nyaura, Mrs. Olanike Adedeji of the United Nations Population Fund, Pharmacist Paul Tanui, Senior Programs Officer, African Medicines Regulatory Harmonization Program under the African Union New Partnership for African Development, NEPAD. Oloye Sharafuddin Abiodun Ali, former Secretary to Oyo State Government. The immediate post-acting Vice-Chancellor of Obafemi Awolowo University, Professor Anthony Elujoba, a Professor of Pharmacy. Chief Medical Director of the University College Hospital, UCH, Professor Temitope Alunge. The Chairman of the Pharmaceutical Society of Nigeria, Oyo State Branch, Pharmacist Abiodun Ajibade, and Pharmacist Amid Ghana Muhammad, Head of Drug Manufacturing Unit, Aminu Kano Teaching Hospital, Kano, Nigeria. The participants at the two-day conference brainstormed on the theme Critical Appraisal of Regulations Guiding Access to Quality Medicines in Africa on the first day of the conference, while the second day was focused on the theme Strategies for Improving Access to Quality Medicines in West African Sub-Region. In our welcome address, the Director of Center for Drug Discovery, Development and Production, CDDDP, Professor Chinedum Peace Babalola, revealed that the major challenge affecting quality health care in Africa is poor access to certain essential medicines. Furthermore, the CDDDP boss highlighted the 5 objectives of the conference. She also noted what essential medicines could do if they're available, affordable, of high quality, and if properly used, citing instances of USA and Nigeria as examples of how important it is as a global public health issue. Professor Babalola maintained that the array of participants at the conference were meant to foster a critical appraisal of laws that affect access to quality medicine in Africa. Meanwhile, the chairman of the conference, Health Minister, Professor Isaac Adewale, speaking through his representative, the Director of Food and Drugs, Ministry of Health, Mrs. Gloria Modupe, highlighted the major activities of the Ministry of Health. Mrs. Gloria Modupe further mentioned some of the efforts made by the minister towards ensuring access to medicines and creating employment since his assumption of office. The health minister, however, advised that all recommendations made during the course of the conference must be effectively implemented to ensure better health care in the country. Then came the moment for critical appraisal of regulations guiding access to quality medicines in Africa, being the theme of the first day of the conference. The chairman, Pharmaceutical Society of Nigeria Board of Fellows, PSN, Barrister Chinedu Modi, in his own paper titled A Critique of Relevant Laws Governing Medicine Regulations in Nigeria, identified the pitfalls of the Poison and Pharmacy Act of 1958, having first mentioned the benefits therein. Barrister Modi, who is also a pharmacist, further identified the drawbacks in the PSN Act. Moreover, he did not spare NAFDAC Act in his assessment of the laws. The laws and acts that regulate access to medicines in Nigeria, as identified by Barrister Modi, included Pharmaceutical Society of Nigeria PSN Act of 1982, Poisons and Pharmacy Laws, National Agency for Food, Drug Administration and Control, NAFDAC Act, as well as Counterfeit and Adulterated Drug Act. Mr. Paul Tanwin, the Senior Program Officer of African Medicine Regulatory Harmonization, took the discussion to the African continent level in his paper titled African Union Model Law on Medical Product Regulation. It did an overview of AMRH as established in 2009. Pharmacist Tanwin further pointed out the provisions of African Union Model Law on Medical Products Regulation and Harmonization in Africa, which was officially endorsed in Ethiopia in 2016. He further mentioned the main principles in the implementation of the model law that could aid its adoption in any African country. Mrs. Oni, whose presentation was titled Good Manufacturing Practice, an important aspect to achieving quality medicine, explained how Nigeria, through NAFDAC, has been participating in the WHO initiative to ensure access to quality medicines. She also mentioned the status and impacts of various regional initiatives and collaborations in Africa. She went further to highlight the challenges hampering the process of improving access to quality medicines in Nigeria and how the agency tackles them. Mrs. Oni also mentioned that NAFDAC was proposing a review of the extant laws to reflect appropriate punishment for offenders. Earlier, during the opening ceremony of the conference, the Center for Drug Discovery, Development and Production (CDDDP) conferred awards of recognition on some eminent personalities in appreciation of their contributions to the medical and health industry. The recipients of the awards are the Minister of Health, Professor Isaac Adewale, for his contributions towards improving maternal and child health in Nigeria. Mrs. Chukwuma received the award on his behalf. The wife of Oyo State Governor, Mrs. Florence Ajimobi, was awarded for her efforts in providing easy access to basic medical care through ABC Foundation. Mrs. Dolapo Oyedipe received the award on her behalf. The former governor of Ondo State, Olusegun Mimiko, was awarded for the laudable health policies he implemented while he was the governor of Ondo State. The Director General of National Institute of Science Laboratory Technology, Mr. Y.H. Gbadegeshin, was also given an award of recognition for his contributions on the fight against Ebola virus disease and Lassa fever. The president of the Pharmaceutical Society of Nigeria, Pharmacist Ahmed Yakasai, was honored for his outstanding support towards improving access to medicine and pharmacy professions in Nigeria. Also awarded at the ceremony was the Registrar of Pharmacist Council of Nigeria, Pharmacist Elijah Muhammad, for his tenacious efforts towards improving medicine regulations in Nigeria. The Speaker of Oyo State House of Assembly, Honorable Michael Adeyemo, was honored for his role in accelerating the passage of Healthcare Bill in Oyo State. Engineer Aduremi Olaniyan was awarded for his philanthropic efforts in the area of healthcare for the people. First Lady of Oyo State, Mrs. Florence Ajimobi, who was represented by Mrs. Dolapo Oyedipe, appreciated CDDDP for the award, pledging commitment to ensuring good access to free basic medical care and cancer prevention services in the state. She also used the occasion to highlight the activities of our organization, ABC. In his own address, the Speaker of Oyo State House of Assembly, Honorable Michael Adeyemo, represented by the Deputy Speaker, Honorable Abdul Wasi, appreciated the award and he spoke about what the award will do for him and the entire members of the State House of Assembly. The ex-governor of Ondo State, Dr. Olusegun Mimiko, through his representative, appreciated the award given to him by CDDDP, pledging his readiness for more partnership with the center in caring for mothers and children. He also mentioned what he has been doing in this respect since he left office. The second day of the international conference, being Wednesday 30th August 2017, had as its theme Strategies for Improving Access to Quality Medicines in West African Sub-Region. Participants, therefore, proposed possible solutions to the problems of drug inaccessibility in Africa, having the previous day brainstormed on the factors militating against access and affordability of quality medicines, as well as the legislations regulating them. The National Program Specialist, United Nations Population Fund (UNFPA), pharmacist Olanike Adedeji, during our presentation explained the activities of our agency UNFPA in the area of health. Pharmacist Adenike also mentioned how UNFPA is tackling maternal mortality and the benefits that have accrued from it over the years. Also speaking at the conference, the Registrar of the Pharmaceutical Council of Nigeria, Pharmacist Elijah Muhammad, represented by Pharmacist Amaka Okafor, highlighted proposals meant to tackle the identified challenges to the practice of pharmacy in Nigeria. The Southwest Zonal Coordinator for NAFDAC, Mrs. Yetunde Adenuga, who presented a paper on behalf of the Director of Pharmacovigilance and Post-Marketing Surveillance, NAFDAC, Pharmacist Ali Ibrahim, explained on the importance of pharmacovigilance in improving access to quality medicines and other regulated products. Mrs. Adenuga defined pharmacovigilance thus. She also included NAFDAC's mandate. She further stated NAFDAC's expectations from marketing authorization holders, which was in line with Nigerian National Pharmacovigilance Policy. The Pharmacovigilance Unit under NAFDAC has reporting tools, which Mrs. Adenuga explained. She, however, encouraged healthcare professionals to assist in the pharmacovigilance activities. Mrs. Adenuga also recommended solutions to unauthorized importation and distribution of medicines in Nigeria. As expected, reactions and questions followed the three presentations, and the presenters also responded. The session also witnessed, in particular, answers to a question that bothered on fine-tuning regulations in favor of entrepreneurship. There was also a response to Professor Elujaba's question about the number of deaths pharmacovigilance has recorded as a result of using herbal medicine. The Director of Food and Drugs, Federal Ministry of Health, Pharmacist Mrs. GMO Chukuma, who represented the Health Minister, Professor Isaac Adewale, made the first of the final presentations titled Implementation of Essential Medicine Program and National Drug Policy, Nigerian Experience. Mrs. Chukuma traced the history of drug policy in the country. She also highlighted the criteria for selecting essential medicines. She spoke further about the concept of national drug policy. The achievements of the policy were also mentioned. Professor Edith Ajayoba, a professor of pharmacognosy, Faculty of Pharmacy, University of Ibadan, was next with the topic Improving Access to Quality Herbal Medicine Use in Nigeria. She started with the story of a family survivor on leaves and herbs in Sambisa Forest, proceeding on to briefly emphasizing the need to eat less of animals. Professor Ajayoba traced the history of herbal medicine use, mentioning the available herbs then. She also differentiated herbal medicines from modern medicines. Then she spoke about WHO's agenda for herbal medicines between 2014 to 2023. She did not leave out African traditional medicine and its resources. And what about the markets for traditional medicine and its products? She mentioned examples of medicinal herbs and what they are used for. Professor Elujoba, the immediate post-acting Vice-Chancellor of Obafemi Awolowo University, also corroborated Professor Ajayoba's assertions by providing strategies on developing herbal medicines in Nigeria. The Dean, Faculty of Pharmacy, Obafemi Awolowo University, Professor W. Aaron, spoke on Drug Revolving Fund and optimizing drug financing in developing economies. He explained what Drug Revolving Fund is and its shortfalls. Professor W. Aaron further identified the possible sources of capital investment into the Drug Revolving Fund. He did, however, stressed his own approach to the Drug Revolving Fund. He also highlighted the specific reasons why the Drug Revolving Fund has not been working. Professor Aaron did not only highlight the problems, he also recommended solutions. And here is his final message with respect to making the Drug Revolving Fund functional. There were also questions, comments and reactions from the participants and facilitators after the presentations. The first question was directed at NAFDAC, but Professors Elujoba and Babalola added another angle to it. Meanwhile, pharmacist Chukwuma thought it was better for the professors to tell the regulators what to do. After one of the participants emphasized the need to pay attention to clinical trials of herbal products, Professor Aaron provided a clarification and recommended post-market surveillance. Similarly, Professor Elujoba corroborated Professor Aaron's submission by citing the resolutions of the defunct African Union Inter-African Committee on Traditional Medicine Practitioners meeting held in the 80s. However, judging by the response of pharmacist Chukwuma to a question about the seeming difficulty in the integration of herbal medicines in the nation's health management system, there appears to be hope after all for herbal medicines in Nigeria. Other questions generated salient responses from the facilitators as well. At the wrapping-up session, the director of Center for Drug Discovery, Development and Production, Faculty of Pharmacy, University of Ibadan, Professor Babalola, commended the speakers for addressing the objectives of the conference in their presentations. Thereafter, the speakers delivered their key points. The Director of Center for Drug Discovery, Development and Production, Professor Babalola, gave the closing remarks on behalf of the Dean of the Faculty of Pharmacy, University of Ibadan. She used the opportunity to thank God and to appreciate everybody that participated in the conference. Thus, the 2017 International Conference, organized by the Center for Drug Discovery, Development and Production, Faculty of Pharmacy, University of Ibadan, formally came to an end. Meanwhile, as it is often said that what to do in terms of policy is not the problem in Nigeria, but the challenge is implementing it. The confidence is that the resolutions of organizers, guests, and participants in the international conference can be trusted, hoping God will make them all work out well.